This episode of the podcast is brought to you by our friends at Regrow.
Hey, cannabis operators, got a couple questions for you. Are your SOPs tied directly to your cultivation plans? Can you easily manage your inventory and workforce and vendors from a single system? Can you manage compliance across multiple licenses and states? Do you have performance analytics to help you maximize your 24-month cultivation and manufacturing plans? If this is not the case, Regrow is there to help. They can help you maximize your yields and consistency. Think of Regrow as the single pane of glass view into your entire supply chain. They're available globally with native localization and foreign language support. So if you're a cannabis company searching for a strategic business partner to help you automate your business, scale effectively, and make the supply chain work for you, you can find Regrow at regrow.io. That's regrow.io. Regrow, the premier cloud-based cannabis supply chain management system. Kim Stuck, welcome back to the podcast.
Hey, how's it going? Thank you for having me.
Yes, of course. It's great to see you again. And we actually got to see each other in person recently at the Delta 8, Delta 9 psychedelic medicine conference in Dallas. That was awesome.
Yeah, it's kind of a weird place for like a conference like that. I wasn't really expecting it, but it ended up being really awesome and just met a really crazy amount of really cool people. Actually, it was really fun. And then you were there, and so we got to hang out a little bit, so that was always awesome.
Exactly. Yeah, and I got to meet so many different people too. In fact, I had Cody Guy on, who has a really interesting story, and I just published that episode, so check it out. He's the longest brain cancer survivor, certain type of brain cancer survivor out of UT Southwestern, so he has a lot of insights. But Kim, you're on today, and you are the founder and CEO of Allay Consulting.
Yeah, it's actually pronounced Allay.
Allay. I think I did
okay.
that the first time we talked.
I think so
the
too.
Second time that I've messed up on it.
It happens all the time. So it's actually an English word, and it means to calm or soothe stress and anxiety.
Allay. Ooh,
yeah.
Okay. Well, is your background? Like, tell us kind of I know we kind of went through it already, but let people understand kind of, why you came up with that name, why you're in the consulting space within the cannabis, and I think psilocybin industries as well. So yeah, the floor is yours. Give us the background.
So we started our psilocybin division at the beginning of 2021 because Oregon had voted and had legalized psilocybin therapeutically. And so they're still, coming out with regulations, and I don't think licenses are going to be granted until 2023, but it was still very exciting. And I get to be on some of the work groups to write those regulations and stuff. So I'm super excited about the psychedelic side of everything. So I actually started in the cannabis industry in 2014 as a regulator. So I actually worked in Denver as a cannabis regulator for DDPHE, which is Denver's health department, essentially. And it was really crazy. And I didn't know much about cannabis back then, other than I was a person that grew up in Colorado, right? Everybody has been around cannabis that's there. So it was really exciting and an interesting time to be a regulator, because new industries don't just pop up like that. Like, it's the first time in 70 years that a new industry was born. So it was pretty exciting, pretty cool, but it really wasn't where my heart was. In fact, that job kind of taught me where I wanted to be. And that was working with the industry. I fell in love with the people and the plant and just the industry as a whole, and all the cool things that were happening and all the innovation. And I just absolutely fell in love. So I actually started the company on this day in 2017. So today is our 5th year anniversary, actually.
Wow.
Of the company.
Congratulations. Yeah. That's huge. 5 years in the making.
Yeah, it's nuts.
Well, and it's so interesting how you had that perspective, right? As a regulator coming in, enforcing the laws, basically, right? And making sure things are up to code and standard within the state of Colorado at the time. And now you kind of are on the other side, where you're providing compliance strategy and services to help these operators.
Yeah. So we mainly focus obviously on state regulations, but the state regulations are actually our easiest set of regulations, believe it or not, that we work with. Because most of our clients are very forward thinking. They're thinking about what's going to happen in 10 years, what's going to happen in 5 years, what's going to, going to happen, in 20 years. And so we really focus on like FDA, so food safety, GMP certification, ISO certification, OSHA, those kinds of things. Like, what are these companies going to do when the FDA and OSHA start getting involved, or when they need to start selling internationally? How are they going to stay in business? And compliance and food safety and worker safety is, that's the forefront of what they're going to have to pay attention to. So a lot of what we do is not actually required, but we're busy because there's a lot of people out there that are trying to improve their business and be ready for when all that craziness happens. Because when it does happen, I have a feeling we won't be able to take on everybody, so it's going to be a little crazy. So we're trying to be as proactive as possible.
Yeah, I mean, that's really an ideal client also, right? I mean, someone who's in it for the long term, forward thinking, like you mentioned, and going about it the right way for what's to come in terms of FDA regulation.
Yeah, definitely. And there's quite a few people out there that are starting to do it. I remember when we first launched, a lot of people just were like, nobody needs that. Nobody's going to do that, and now people reach out all the time and they're like, oh my gosh, we got to get our act together. We got to figure this out. And it's funny, being in the industry for so long and seeing it when, back in the Wild West days in Colorado in 2014, and to now, I mean, it's like almost a completely different industry. And the people who are still involved and have been from the beginning, their attitudes have changed a lot. And, their mindset is starting to, embrace the fact that federal legalization is going to happen. And, they want to stick around for it, right? They want to compete and be one of the leaders in the industry. And this is the best way to do it right now. So
totally. Yeah. I mean, all the signals are pointing to it. Public support is on an all-time high. Rhode Island became the 19th state to go adult use. So
Yay.
The dominoes are falling there. Yeah. And, one thing that's interesting as I hear you talk, because, you mentioned that you launched the psilocybin side of the business as well, is how those differ, right? Because we know how the cannabis industry is kind of the Wild West right now. And Dustin Robinson, who was recently on the podcast, he's in like top 100 experts in the psilocybin industry right now. And he made a really great point. He said that while cannabis has gone the CPG route, psilocybin has been very much more centered around the pharmaceutical side, and it's gone through more of the rigorous testing and all that type of stuff. So my question to you is like, what does the client base look like on the psilocybin side because of all the regulation that they're going through pharmaceutical?
Yeah, so it is vastly different. Even the approach is more pharmaceutical, whereas I felt like even when medical cannabis was approved, like back in the day in California and in Colorado, there was still like, oh, you could just go in and say that you have menstrual cramps and get a card, and it was like no big deal. Whereas with the psilocybin side, people are really taking the pharmaceutical stuff seriously. There is already a written CFR 211, which is pharmaceutical, like FDA laws for mushroom growth. So the regulations for like growing safe mushrooms that are able to be sold to the public, it already exists, right? And so the only things that are different, it's just going to be very easy to like plug it into, if that makes sense, because we've already had like lion's mane and all of these therapeutic mushrooms on the market for so long that adding the psilocybin component to it in a therapeutic sense is easier, right? It's not as vague, and there's a lot more studies that exist for psilocybin than there is for cannabis, for THC even, which blew my mind.
That blows
really,
my
right?
mind. I was just going to say that. I'm like,
yeah,
it's so crazy. Yeah, go ahead. Sorry.
Yeah, cannabis has actually been more demonized by our government than psilocybin has, which is like totally baffling to me. But there's all these studies from back in the 60s when people were doing experimentation on PTSD and trauma and depression. And so, there's a lot of like really legit data that backs up that psilocybin can help with these things. And so that alone already is launching it on that pharmaceutical platform. So it's really, really going to be interesting to see what happens. I think it's going to be very different, but very similar as well. I don't know. I think it's going to spread very quickly once we start implementing it. I think that a lot of states are kind of looking at Oregon and they're seeing if the sky falls after about a year of their program. And when it doesn't, I have a feeling that a lot of other states are going to use this because there's such a huge mental health problem in America. I mean, we look at all of the shootings and all the tragedies that we have seen just this last year, and then all the COVID stuff, so many people, suicide and depression. And it is kind of a perfect time for this drug to be introduced into the United States. And I think that there's, believe in what you want. But it's almost like divine intervention at this point. I'm like, this is so great that this is happening right now because we need it really, really bad. And I think that the number one way that it really like lights me up, where I'm just like, I'm so excited for this, is with veterans with PTSD. Yeah. And they have had such amazing studies and amazing results from this. I think that that's one thing in America that it makes me so sad is just how we kind of treat our vets when they come home. We kind of almost push them in the back room or sweep them under the rug, if you will, and kind of forget that they are not the same person as they were when they left. And we need to start addressing that issue. And I think that psilocybin is going to really, really help them. And I'm just really excited. I'm so excited for it. And I can't wait to see what happens because I think that it's as hippie as it sounds. I think that these plant medicines that we're finally starting to tap into and our government is finally allowing this stuff to happen. I think that it can heal the United States. I think it really can. So I'm super stoked about it. I don't know. I get really excited.
I can't tell you, I'm bursting with energy because I'm getting pumped up with everything that you're saying. I could not agree more. It's so exciting to see that psilocybin treatment is getting the traction and the attention that it is in a positive light, right? It's not getting demonized as the cannabis plant once did, or still has, or is still, enduring. And you mentioned, you said a lot of great things that I think we should unpack. And the first is, the current state of like what we're going through. You mentioned COVID, you mentioned the school shootings, the tragedies that are happening all around us. And, we can talk about certain issues like, guns and this and that, which of course are important, but the root, in my opinion, is it's mental health. I think that there's a serious mental health crisis out there. And these types of treatments coming to the forefront are great because we've tried the other treatments, right? I mean, the opioids have been out there. The benzodiazepines have been out there, right?
Yeah.
So it's great that we're looking. And then your last point about Oregon and how the sky, won't fall, and I don't think it will either, is what Canada just did, right? I mean, they announced, I think this week, that within the BC, they're decriminalizing all drugs, just like Oregon did. So there's another like case study that's about to happen, right? And see how it plays out, because we know that the other way hasn't worked. So why not try something new? And I tip my hat to those countries and the states that are doing that.
Yeah, I mean, hundreds of thousands of Americans are thrown into jail just from cannabis criminalization every year. I mean, it's insane. I think I was doing a talk the other day, and one of the things I was talking about is that it costs American taxpayers about $3.6 billion annually just for people who are in jail for drugs. That's insane to me. And cannabis from 2014 has brought in, 11 billion, and it's like, why aren't we seeing like where this is going? So, and I don't know how exactly, I haven't read up on how exactly Canada is doing it, but I know that here in Oregon, instead of, it's really interesting how they want to run their program. So if you get caught, let's say you have some cocaine on you, right? And you get caught and arrested. Well, they don't send you to jail. They actually take you to a facility that has a therapist. And you have to sit down with that therapist and they have like a 30-minute chat with you. And they evaluate you to see if you have a drug problem, if you have an addiction. And if they go, okay, you were just, you don't usually do cocaine. This was some crazy weekend that at a bachelor party or whatever. Here's your $45 fine. Now get out. And if they determine that you do have a drug problem and it's an addiction issue and, or a mental health issue, they actually put you in like an inpatient rehab for the next 3 months. And that's how they're kind of doing it.
Hold on. Wait, so they're actually helping their citizens
it's crazy.
Yes.
By
actually like treating the issue and addressing it like that. Wow.
Yeah. Well, and it's cheaper to send someone to a 3-month inpatient rehab than it does to send them to prison. So, for 10 years, right? Because you can go to prison for a very long time for a small amount of drugs.
Especially cocaine. Yeah,
exactly. Or heroin. I mean, that's a long time. And so if they can address the problems, they have therapists that will help you. So if you do have an underlying trauma or, whatever it may be, because I truly believe that addiction is a response to not dealing with trauma correctly. I actually truly, truly believe that. And if you can address the mental health issues that are causing that addiction or, and people can be addicted to all kinds of things like exercise and, money. And, there's just all kinds of ways that people deal with their own stuff. But when it comes to addiction to drugs, it's just so it kills you slowly. Right. I think it's a great thing that we're doing something about it. I don't know how the implementation is going yet. I honestly don't have anyone on the inside of that program to let me know like I do in a lot of other programs, but it sounded to me like a really good idea. Totally. And I'm just hoping that it really helps because right in Oregon, well, in Portland specifically, we have a huge homeless population that everybody knows about, right? And it got even worse during COVID. And I think it's because a lot of people lost their jobs. And a lot of the people who are homeless have mental health issues. Yep. And that's why they keep ending up back on the street. It's just another cycle that keeps them there. And so I think if we have some of them come into this program and get some real help, we could potentially be solving more than one problem. And it's, it would be really great because you see these people and it's the saddest thing ever. It just breaks my heart. And a lot of the times, people are like, oh, they're doing it to themselves. And yes, okay, they're continuing to do things that plant them back in that place, but it's because they have trauma or other issues that are not being addressed and they don't know how to break that cycle. And so if you can train them how to break that cycle and also get rid of their addiction, or at least have them deal with it a little bit, a lot of good can come from it. And I truly believe that anybody who is an addict can turn their life around. I 100% believe that is a possibility. So I'm excited to see how it goes because I think that if it works here and it works in Canada, I have a feeling they're doing something similar because I don't think any government would just be like, no, we're not going to do anything about drugs. Like you have to kind of do something. Right. So we'll see what happens. I don't know. I'm excited to see it. It's very similar to some European countries like Denmark and some of those. So we'll see.
I mean, it sounds like it makes sense and it's investing in the people, right? I mean, like you said, humans need a support system. They need a guide. If you're caught in a rut or you're doing the same thing over and over again, and that's all and it's affecting your life, it's affecting those around you. I mean, you needed someone that can help guide you or help uplift you and put you on the right path. And that's important. They need that. And in addition to the treatment and everything else that comes along with it, of course. Right. But that's great. And I really do hope that it works out here in the US because that doesn't seem to be the culture of the US healthcare system today. And especially during COVID, I learned that, right? Like it wasn't about treating COVID as much as it was preventing the absolute worst case scenario, which was hospitalization and death.
Mhm.
And it's sad, right? I mean, because it's become profitable for big pharma and other entities involved, but that's a whole separate
Yeah,
discussion.
we could talk
And
about that for days. Yeah. There's a
exactly.
reason why I'm in this industry, because I can sleep at night, you know?
Right. You have a conscience. Totally. Yeah. Well, let's switch gears and go back to your point about good manufacturing processes, and what's to come, right? So, like when you're meeting with your clients, what are you, if they're not following this, like say someone's just approaching you, like what is some of the first things that you're looking for, and what is some of the initial advice? I know that you pay for the services, so don't give away your secret sauce, but
Oh.
some high level stuff.
Yeah. Well, I mean, everything kind of has to be high level because every single company is completely different than the next. And so it's hard to just give like, oh, here's a really easy tip and trick. Like, because every single, like, if you're doing butane extraction and winterization, and other people are doing ethanol, it's like totally different. So it's kind of interesting in that way, which I love that because it keeps me on my toes. It's like, oh, what is this new process? And, it's amazing. But yeah, I mean, essentially, good manufacturing practices. So GMP is a certification that companies can get. It was not always available to the industry. In fact, 5 years ago, when I started this company, it was not available, and we had to fight really hard with some really huge accredited certifying bodies to try to get them to include us. And now we work with 6. So it's really awesome that we were very convincing when we
Right.
when we
You must
need
have
to
been. Yeah,
be.
geez.
Yeah. So anyways, so it's a certification, and it essentially is based on FDA food code. But it's a little above and beyond because each accredited certifying body has their own kind of twist to their own regulations and all that fun stuff. So all of them are a little different. All of them cost a little different price. So sometimes it can be kind of confusing to like navigate that whole process. But that's what we do for our clients. So it's huge risk mitigator. It's essentially putting food safety processes and quality assurance processes in place and training your staff to do so that you're creating a product that is not going to hurt anybody, right? And
Right.
and it's going to be consistent every time, and that kind of thing. And so people really like it. It benefits a company in so many weird different ways that I didn't even like think of. Like turnover rates fall significantly when you have GMP in place because people have a little more pride in what they're making. And it's very spelled out what they're supposed to do every day. What hat are they actually wearing? Whereas a lot of cannabis companies, people are like, I don't even know what my real job is. I just do like this and I see stuff that needs to be done and I just do it, and it gets stressful. So when you have like a set thing that you're doing every day, and I know I have to fill out this log, I know I have to do this, it makes them feel more secure in what they're doing, and they feel more confident in their job. So weird things like that. But for the most part, you can sell your products for more. Consumers like to see GMP on things, which is really great because I, as a consumer, only use GMP products because I have seen the inside of these places that don't have it. It's a little frightening sometimes. And then not only that, it's a huge risk mitigator. So if you're planning on selling your company at some point, or you're trying to get investors, or anything like that, you have to have it. Every wholesale food manufacturer in the United States has this certification. It's like the standard. And that's exactly what's happening in the cannabis space as well. And even states like New York, Florida, Maryland, I think, just said they actually are requiring the certification before you even get licensing. And that is a trend that is happening more and more. And people are, I think it's a little upsetting because there is upfront cost. But the issue that governments are having is they don't have the bandwidth to go in and regulate all of these new companies. And so instead of just having a health department that doesn't actually go into places like most states, and they're completely unregulated when it comes to health and safety of product, they just say, hey, we'll have a third party accreditor do this for us. And if you have this, then you can get your license and, you're fine. So it makes it a little easier on the regulatory body. It is a little more expensive for the upfront cost. But once everything's in place and you're used to it, honestly, it's like very easy to keep that way. Yeah. So
you've done all the upfront work, right? I mean, all the processes and the SOPs, everything's there. So you're just kind of rolling with it.
Yeah. And I mean, things will change in your facility throughout time. So you have to update those SOPs and you have to change, add STS sheets and things like that. But I mean, most of our clients, because we're very project based, we come in, we have clients that have been with us literally for 5 years, but most of them, we come in, we get the certification or we get to the, okay, now you're OSHA compliant, you're good. And then we leave and they can call us if they need us. But we're really project based. And so with them, it's so funny because every single one of our clients is like, okay, our audit, because they have to have an audit every year to keep their GMP status. They call us every year for like 2 months in advance. Like, can you come in and make sure? And we come in and usually we find a bunch of stuff and change it real quick and then they're good to go. But it's very light maintenance once you have everything in place, like honestly.
Got you. Well, no, that's super helpful and really good background to have. And I mean, since we're on the topic, are there any other certifications that are offered in cannabis or hemp that are worth mentioning?
Yeah. So obviously GMP, I feel like that's the baseline. So most of our clients start with GMP and then we like add stuff to the top of it. So ISO 9001, you can get ISO 22000, which is actually the requirement to sell to most international like countries. So like France, Germany, those kinds of places, even wholesale food manufacturers in the United States have to have ISO 22000. It's like GMP on crack. Like it's like just that next, like, oh my gosh, this is a lot. But if you can get GMP, if you can get ISO 9001, usually it stacks right on top. And a lot of those SOPs and documentations, all of those are already done. So it's kind of nice to like be able to do it in that like step way. Organic certification for the hemp side, it is possible. And we have a lot of clients that are now, they want to be organic in their facility. So we are getting people that. And then we also work with cultivations to get the GACP, which is good agricultural practice certification. That's like GMP, but just for a cultivation. And that's where most of our like psilocybin companies come in, right? That they're wanting that certification so that when the licensing becomes available, they will be like better than everybody else and get that license. So a lot of our cultivators are wanting that, and we're working with a lot of them. That wasn't available until just this last year. So it's slowly becoming, I don't know. And that's my goal, right? Is to get this industry to be treated like every other industry. And so slowly we're just kind of chipping away at that. Like, okay, we're here to stay. Come on, guys. Like, come on, you want to work with us, so it's a lot of convincing, but we're getting there. So it's exciting.
Yeah, no, it sounds like it. And there's got to be a lot of these different nuances that come up, right? And one that I can think of from a compliance regulatory standpoint, it's been a huge issue in the state of Texas, has been Delta 8.
Mm-hmm.
And how the law views Delta 8, and I think it won in court. So I think Delta 8 is good in the state of Texas now, but now I'm seeing billboards of Delta 9. And I'm like, how are they able to market Delta 9 products in Texas? And it says Delta 9. So what's going on with all this? Like, how are they able to do it? And what's the FDA doing in terms of some of these claims when it comes to Delta 8 and Delta 9 in non-adult use states?
Yeah. So this is so tricky. And I am not a lawyer. I'm just going to preface that. There's a lot of lawyers that, and it's funny because I speak to lawyers all the time. And some are on this side of the fence and some are on this side of the fence. And so if it's derived from hemp, it technically is legal in some states. It depends on the state, right? Every state kind of is allowing different things. Obviously, many states have banned Delta 8, Delta 10, and Delta 9 that's derived from hemp, unless it's below the 0.3%, right? But if you have a chocolate bar that is below 0.3%, that's still a 50 milligram THC chocolate bar sometimes. So, you know what I mean? Like, there's so many weird loopholes of like, yeah, technically that's legal. Like, oh my gosh. So this is something that as regulators and as, regulation writers, we really have to take this into account and think about all of these different variables. And the issue is that when you have a brand new thing that you're regulating, you don't even think about these things. So you kind of have to roll with the punches when things start to come out. And right now, because the FDA isn't really involved, because I don't know why, it's their jurisdiction. They have the ability to regulate all hemp. But we've been waiting for over 3 years for those regulations. They're claiming that they're writing them, but where are they? So it's very frustrating, especially on our end, because we always want to give our clients an answer and we don't have one. We're like, well, it depends on what state. We have Delta 8 clients that are getting GMP certification, and and they're great. And they're doing really good.
Right.
And they're in states that are legal. Like, obviously we wouldn't take on a client that's doing Delta 8 in Colorado because that's not allowed. But in Texas and Florida, those kinds of places that, there's certain states that are just like, yeah, it's fine. But yeah, it's really interesting to see this happen. And honestly, I called it years ago. Like, I was like, because we didn't just legalize a plant, we legalized like 44 new cannabinoids, right? That we'd never messed with. And then you get these chemists, which we work with a lot of really awesome chemists that are constantly doing R&D and tweaking things and figuring things out and coming up with new cannabinoids that are derivatives of cannabinoids that maybe don't exist in the actual plant. Like, it's insane what they can do. So
yeah, I heard of HHC for the first time when I was at the conference where I saw you, and I was like, wait, what? HHC? And I gotta be honest, I didn't even try it. Like, I don't know, like that, because it's synthetic, right? I mean, it's not naturally occurring in the plant. It's man-made with chemicals. Is that right?
Yeah. So it's a derivative. So I don't like the word synthetic because I think that there are a place for all of these cannabinoids. I actually really do.
I agree with you. Yeah. So you're right. Synthetic gives it kind of a bad spin.
People kind of think that's, and I just don't like that word. And there's a lot of words that I don't choose to use in the industry for that same reason, but they're derivatives. They're isomers of, THC, and that's kind of where the new trend is going, but it's not a trend. I mean, there are going to be thousands and thousands of these discovered in our lifetime.
Well, and do you think that those are going to continue to emerge? Like, say tomorrow legalization happened throughout the country, like do you think that those would like still emerge? You think HHC and Delta 8 would be in existence?
So I do. I actually do. I think that they all have a place because each one kind of treats different things, right? And when we do have more studies, right, once we get some actual R&D and some data, I think a lot of these things are going to, who knows, one of them might cure cancer. I have no idea. It would be amazing if we could like harness that as medicine. My issue with all of this is the FDA is not regulating it. They're completely unregulated.
Right. So let me just clarify one thing though. So with like CBN and CBG and like all those minor cannabinoids, right? Are those the same as HHC and Delta 8, which have recently emerged as derivatives? Like, would you put those in the same bucket?
No, I really wouldn't.
So that's why I'm asking the question. Yeah. Like, if Delta 9 was legal, I don't know why we would make, use the derivatives to, what I don't want to use the word synthetic now.
Right.
You know what I mean? Like, create it. We wouldn't create it.
Right. And a lot of people are using like, they're not naturally occurring cannabinoids or, and there is Delta 8 in cannabis plants, but it's like really small. So you can't just like extract it, but it's a very easy thing to take THC and turn it into Delta 8. It's a very like, it's a chemical process. The problem is a lot of the chemicals that are used are like hydrochloric acid and, very dangerous chemicals. And when they're unregulated, they're not licensed, they're making this in their basement. They're not testing, right? There's no testing done on any of these. It's not required. that's where I'm like, oh gosh, this is a public health nightmare, but like I said, I think that if the FDA figures out the CBD rules, that's going to be the first step in laying the groundwork. And then all they have to do is write something in that says any derivatives from CBD or any cannabinoids from a hemp plant or any THC, marijuana, if they want to use that word, plant, because they probably will.
Right.
And, it's like, that's all they have to do. And then everybody has to follow the CBD rules. And that's how easy it would be. But they're just trying to fight this battle that they can't. I mean, it's an avalanche now, right? If the minute Delta 8 is banned, they've got Delta 10. The minute Delta 10 is banned, then they've got
You're so right. Yeah.
It's
so
like
right.
They need to just broadly say, okay, any cannabinoids, any derivatives of cannabinoids, any isomers, any, just blanket statement, and then make them get licensed with the federal government and follow the same rules as everybody else. Because when you look at CBD oil and THC oil, from a public health standpoint, they're exactly the same. They have the same issues when it comes to bacteria. They have the same, or non-issues, or, they are treated the same. The only difference is that and they will have to write the regulations this way, but if it's intoxicating in any way, they would need a warning symbol and like dosage and that kind of thing. Right. And honestly, it would not be that hard to just put that in the regulations and make everybody follow it. But the thing is that they're looking at it. I think they're just overwhelmed because they don't understand it. They don't understand the science, and they're not really listening. I mean, I've actually gone to roundtables with the FDA and explained a lot of this stuff to them, but this was before this time, right? Every year it's like something new. And I think they're just like, I don't even know. I don't know what we're going to do. I don't know. It's like hard to tell what they're really doing, but 3 years, it doesn't take 3 years to write a set of regulations. Like
no,
we've done it in 6 months. Like, come on now.
Yeah, my mind was blown when you said that 3 years. And I love that you shared that you've actually sat at the table with the FDA, because I've always wondered, and I'm sure the listeners and people will be watching this is like, well, what are they doing? What are they thinking at this point? And you're so right. They're probably so overwhelmed with this and so behind on the information and the education, the science, that it's the perfect analogy you said was the avalanche. Like this huge ball of snow that's rolling down this mountain where it's almost hard to stop at this point, right? Like you
can't stop it. And that's the thing is, and it's funny. So I'm a certified professional in food safety. I'm a certified quality auditor. So I also speak at like food safety conferences that have no cannabis people at all. And it's just a bunch of regulators. And it's so funny. I actually had an FDA agent who was sitting at the table with me at lunch, and he was like, I think we should just ban it all, just like not allow it. And I was like, really? Because you'd be shutting down a $30 billion industry, CBD and THC together in the United States, $30 billion industry, buddy.
The THC is projected at like 100 billion.
Yeah. Like good luck.
Yeah.
Do you realize how many jobs I'd be on the street. Like this is all I do. This is all I know.
Right.
And so
not to mention the patients that need the medicine. Right. And like, I mean, yeah, like what an ignorant statement, but I don't blame him, because like you said, he's probably so oblivious. When you pressed him on that, did you realize right away that he didn't know what he was talking about?
Yes. Oh, it was so obvious. And that's okay. I came from a spot, I didn't know anything about extraction. I didn't know anything about the chemistry of it. And I still have to call my friends that are smarter than me to explain it to me. Right. I mean, that's life. Reality. But it's like, it's baffling to me that they're not even, at least these particular people I was talking to, they just were so against it. And they had this like, oh, it's just a bunch of stoners. And it's why are we even like appeasing this? And it was just like, you really need to like read some stuff. Like, just, like here's some articles, like it really is doing really great things. And, and I mean, the amount of jobs, if they shut down the industry, the amount of jobs that would be lost, there would be a public outrage. I would be marching in the street. Like it would be like, seriously. And I think that they know now. I think maybe they were considering that at one point, and it is way too far gone now. I mean, there's no way that they can shut Pandora's box at this
No,
point.
no way.
They just need to be smart about it, and they need to get it done. This sitting on their hands and not actually working on this, or, putting out regulations, it's going to hurt them so much more in the long run. And it hurts my heart to say this, but it's almost like they're just waiting for a disaster to happen. Like, all these products are out there that are being unregulated, that are potentially unsafe. I mean, you heard about in the UK, that woman that ate that gummy and died because of the residual chemicals. It wasn't the THC that killed her. Is it, and it's like, okay, right, we need to really get on this. Like, it's a huge disservice to the American public for them to not be doing their job. Right. I mean, their entire job is to protect consumers from unsafe products, and they aren't doing that. And that, to me, is a huge failure. I mean, not that, there's a lot of failures in our government, but this is like the one that bothers me the most, because it affects us all. And when they do put in regulations, they're not going to be easy regulations. They're very, I got a lot of vibes from the entire department when I was a regulator, that they were very biased against it and very unhappy about it. In fact, when I was a regulator, so I worked in Denver as a regulator, as a health inspector. And when you run into an issue that you've never seen before, like fermentation or kimchi or sushi or whatever, you are supposed to call your representative at the FDA, and then they give you guidance on how you should be regulating. That's the way the entire chain works. When I would call them and even mention cannabis, they would just hang up on me. And I was a regulator. I worked for them. And it was insane. It made me like very upset at the time. And so then I got smart and started referring to cannabis oil as lavender oil, because it has the same issues, like microbiological issues. Yeah. And so I would get answers on how to write the regulations based on that. But it was baffling to me that was even an option for them to just ignore me just because I was talking about cannabis, and they're very, I mean, maybe not all of them. I'm hoping that this is changing. I really hope. Because even in our department, there were people that were very like, I'm not regulating cannabis. And I was like, well, I will. Gosh, sign me up, and I'm just hoping that it turns around, and I'm hoping that the FDA starts to listen and learn and figure it out, because it's hurting our industry. All it takes is, one recall, one person dying for other people to demonize cannabis even further. And that's what I want to prevent. I want it to be legalized. I want it to be the same as having a glass of wine at the end of the day. I want it normalized. I want to be treated the same way. I want to have banking. I want to have, it would be really nice to just have, a normal business. And all of us that are so passionate about the plant have been literally going through brick wall after brick wall after brick wall. I mean, we've done so many crazy things, like, just to try to run a normal business, that it's insane to me that they're not allowing it yet. So
I feel you. No, and it's the one thing I'll just add to it, because I mean, you said it perfectly, is the one hope I think that will really kick the FDA in the butt is the fact that cannabis legalization is becoming more politicized by the day, right? Like, the public support is out there. Both parties are totally failing, as we're seeing, right? Like, there's really no confidence in government at this point, and elections are coming up. And I'm not saying that that's going to happen, but I'm saying that it's going to be more and more of an issue that they are going to address, because it's an easy win for both parties. And it's just whoever decides to jump at it first and be proactive.
And it really is a bipartisan issue. I mean, the amount of money that is coming in is insane. It's like any Republican, I feel like, would just be like, well, they're gonna smoke it anyway, so why not just like make a little, and don't get me started on how high that taxation rate was going to be if the federal government would have legalized. I was like 25% on top of the, like, oh my gosh,
crazy.
I mean, people would go out of business. There's like no way.
And they talk about social equity. It's like, all right, how are minority business owners going to enter into this space?
Never.
Ever. No, it's not happening. Yeah.
They have to have, 200,000 in the bank. And, it's like, even with the New York laws, like all the licensing, it's like you have to prove that you've owned a successful business for 2 years to be able to get social equity. And I'm like, whoa. Like, what if you just been like a really awesome employee for the, like, I don't understand, business owners shouldn't, I don't know. There's so many people that have never owned a business before that should try to own a business. Like, that's just like, it baffles me.
And it's,
like,
and it's
how they
hard to
think
be a
that's
business
good.
owner. I mean, firsthand, and being in business for 2 years is a success. That is like
Yeah.
great, because what is
50%
it?
go out of business within the first 2 years,
Right,
like,
exactly.
of normal businesses.
Right.
Like, yeah,
Doesn't make any
yeah,
sense.
it doesn't at all. And and then the conviction thing, that's another thing in New York that a lot of people are getting. If they're not including cannabis arrests, but cannabis actual convictions. Those are the people that will get the licenses, not people that, and then there's a lot of people that have been in the legacy market for, 20, 40 years and have never gotten caught. And so now they can't be in it. And I'm like, oh gosh, like, it's just really hard. I guess that with the convictions, it kind of makes sense because those are the people that like couldn't take out loans and couldn't pass background checks. And, so I get it. But at the same time, it's almost impossible to write a social equity plan that is going to work. I mean, it's just like so hard. There's so many loopholes and so many like weird things, but yeah. But the 2-year business thing, I was like, really, like, no, I think that's a bad idea.
Totally. Yeah.
They're doing it. So.
The one that always throws me for a loop is the person who's been convicted of a cannabis related offense and then can't get a job at a dispensary or
I
like
know.
any type of like trim job or any, it's so backwards. But again, it goes back to your point on education and, working with lawmakers that are open to what the experts are seeing and experiencing every day. And I want to close with this, Kim. You as the expert, I think you have an event. I don't know if it's coming up, but it's LA Palooza. Is that right?
Allay Palooza. You
LA
almost got
Palooza.
it.
I see.
Yeah.
I'm working on it. LA Palooza. Tell us about it.
Yeah, so it's actually on September 23rd. We do it every year. We didn't get to do it in 2020, which was really sad, but we did get to do it in 2021. So we're doing it in 2022 now. And hopefully we won't have all the restrictions that we had last year because we had masks and I think we could only invite like 250 people. So we sold out super quick. Where this year we have 500 people that are coming nice. And it's great. It's essentially a party that we throw for our clients and all of our other ancillary companies clients as well. So it's an ancillary company event where there's 30 booths. It's very boutique. It's catered and we, have an open bar and there's a raffle and a DJ and it's pretty much just to go have fun. But all the booths are ancillary companies that we have vetted and have worked with and like love. And so it's just kind of a good time to go out and mix and mingle and just have a good time and celebrate the cannabis industry as a whole. And I started doing it as like an anniversary party for Allay. And so this one's going to be really big and awesome. And we're going to kind of go all out on it. So, but yeah, if anybody is interested, you can go and buy tickets on allayconsulting.com. So ALLAY consulting.com. There's an Allaypalooza 2022 button and you can get tickets online. And if you have any questions, you can always reach out to me. So
awesome. Where can they contact you, Kim?
Yeah. So my email is Kim, KIM, stuck, STUCK at Allay, ALLAY consulting.com. And we're also looking, I think we have like 5 sponsor spots left. So if you are an ancillary company and are interested in coming to Denver and showing off your products, definitely reach out to me and we can get you signed up.
Very exciting. Sounds good. And I'll be sure to put a lot of that contact information in the YouTube description box so people can find it there also. So,
awesome. Thank you.
Yes. Kim, this was a pleasure to have you back on. Really enjoyed hearing from you and all your insights. I mean, you're right on the forefront, you're in the front lines of what's going on. So thank you so much. And let's do it again real soon.
Yeah, anytime. We love being on your show. It's great.
Awesome. Thank you so much. And thank you all for listening. Bye.
Bye.